Question 1. Which of the following diagnostic methods is most sensitive for detecting active tuberculosis in patients with HIV? A. Sputum smear microscopy. B. Chest X-ray. C. Sputum culture. D. Tuberculin skin test (TST). Answer: C. Sputum culture. Rationale: sputum culture is the gold standard for diagnosing active TB, especially in immunocompromised patients, including those with HIV. Sputum smear microscopy can yield false negative results in HIV patients due to their compromised immune systems. Chest X-rays can show features of TB but are not definitive, and TST is not reliable in HIV-infected patients. Question 2. What is the recommended duration for a second-line regimen in the treatment of multidrug-resistant tuberculosis, MDR-TB? A. 6 months. B. 9 to 12 months. C. 18 to 24 months. D. 36 months. Answer: C. 18 to 24 months. Rationale: the treatment for multidrug-resistant TB, MDR-TB, is significantly longer than for drug-sensitive TB, with the recommended duration being 18 to 24 months, depending on the patient's response and drug susceptibility. Shorter durations may lead to treatment failure and relapse. Question 3. Which of the following side effects is most commonly associated with ethambutol in the treatment of tuberculosis? A. Hepatitis. B. Optic neuritis. C. Renal failure. D. Hyperkalemia. Answer: B. Optic neuritis. Rationale: optic neuritis, which can cause visual disturbances, is a well-known side effect of ethambutol. Hepatitis is more commonly associated with rifampin and isoniazid. Renal failure and hyperkalemia are not common side effects of ethambutol. Question 4. A patient presents with a chronic cough, weight loss, and night sweats. A sputum smear is negative, but the chest X-ray shows cavitary lesions. Which of the following is the most likely diagnosis? A. Active tuberculosis with false negative smear. B. Pneumonia with secondary TB. C. Latent tuberculosis with reactivation. D. Non-tuberculous mycobacteria infection. Answer: A. Active tuberculosis with false negative smear. Rationale: in cases of active TB, particularly in immunocompromised patients, the sputum smear can sometimes be negative despite the presence of cavitary lesions on a chest X-ray. Therefore, the most likely diagnosis is active TB with a false negative smear, requiring further confirmation with culture or molecular testing. Question 5. Which of the following tests has the highest sensitivity for diagnosing latent tuberculosis infection, LTBI, in individuals with a history of BCG vaccination? A. Tuberculin skin test (TST). B. Interferon gamma release assays (IGRAs). C. Chest X-ray. D. Sputum culture. Answer: B. Interferon gamma release assays (IGRAs). Rationale: interferon gamma release assays (IGRAs) are more reliable for diagnosing latent tuberculosis infection, LTBI, in individuals who have received the BCG vaccination, as they do not cross-react with the vaccine. TST can produce false positive results in BCG-vaccinated individuals, while chest X-rays and sputum cultures are not used to diagnose latent TB. Question 6. A patient with tuberculosis is being treated with a standard 4-drug regimen. Which of the following drugs is most likely to cause drug-induced hepatotoxicity? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: B. Isoniazid. Rationale: isoniazid is most commonly associated with drug-induced hepatotoxicity in the treatment of tuberculosis. Hepatotoxicity is a significant concern with isoniazid, and liver function should be monitored regularly during treatment. Rifampin and pyrazinamide can also affect liver function, but isoniazid is the primary culprit. Ethambutol is less likely to cause liver toxicity. Question 7. A patient on tuberculosis treatment develops an orange-colored discoloration of urine. Which of the following medications is most likely responsible for this side effect? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: A. Rifampin. Rationale: rifampin is known to cause an orange or red discoloration of bodily fluids, including urine, sweat, and tears. This is a harmless side effect, but should be communicated to patients. Isoniazid, pyrazinamide, and ethambutol do not cause this discoloration. Question 8. Which of the following is the most important factor in determining the duration of treatment for drug-resistant tuberculosis, DR-TB? A. Age of the patient. B. Drug susceptibility testing results. C. Duration of symptoms. D. Presence of comorbidities. Answer. B. Drug susceptibility testing results. Rationale. The duration of treatment for drug-resistant TB, DR-TB, is largely determined by the results of drug susceptibility testing, DST, which guides the choice and duration of therapy. Age, comorbidities, and symptoms may influence treatment planning, but do not directly determine treatment duration for DR-TB. Question 9. A patient with HIV presents with progressive respiratory distress, a dry cough, and weight loss. A chest X-ray reveals bilateral upper lobe infiltrates. What is the most likely diagnosis? A. Active tuberculosis. B. Pneumocystis pneumonia, PCP. C. Bacterial pneumonia. D. Histoplasmosis. Answer. A. Active tuberculosis. Rationale. Active tuberculosis is the most likely diagnosis given the progressive respiratory symptoms and the chest X-ray findings of bilateral upper lobe infiltrates, which are characteristic of TB, particularly in immunocompromised patients like those with HIV. Pneumocystis pneumonia, PCP, can also cause respiratory distress in HIV patients, but typically affects the lower lungs. Question 10. Which of the following is the primary goal in the management of multidrug-resistant tuberculosis, MDR-TB? A. To cure the patient with the shortest treatment regimen possible. B. To prevent the transmission of the resistant strain to others. C. To reduce the number of adverse drug reactions. D. To treat the patient with monotherapy drugs. Answer. B. To prevent the transmission of the resistant strain to others. Rationale. The primary goal in managing MDR-TB is to prevent the transmission of the resistant strain to others while providing effective treatment. This requires prolonged, multi-drug regimens and careful monitoring. Curing the patient is important, but preventing transmission is paramount. Question 11. What is the mechanism of action of rifampin in the treatment of tuberculosis? A. Inhibition of bacterial cell wall synthesis. B. Inhibition of bacterial protein synthesis. C. Inhibition of bacterial RNA synthesis. D. Inhibition of bacterial DNA synthesis. Answer. C. Inhibition of bacterial RNA synthesis. Rationale. Rifampin works by inhibiting bacterial RNA synthesis through binding to bacterial RNA polymerase. This prevents bacterial replication. It does not affect protein, cell wall, or DNA synthesis directly. Question 12. In the treatment of tuberculosis, which of the following is the most important reason for directly observed therapy, DOT? A. To ensure the patient follows dietary restrictions. B. To monitor for adverse drug reactions. C. To ensure the patient completes the full course of therapy. D. To prevent the spread of TB to others. Answer. C. To ensure the patient completes the full course of therapy. Rationale. DOT ensures that patients take their medications as prescribed, which is critical in preventing the development of drug resistance and ensuring effective treatment. While monitoring for adverse reactions and preventing spread are important, DOT is primarily about adherence to the full regimen. Question 13. A patient with tuberculosis is diagnosed with a drug-resistant strain. Which of the following is the most appropriate next step in treatment? A. Start a second-line drug regimen. B. Stop the current regimen and start new first-line drugs. C. Continue the current regimen and monitor. D. Start the patient on immunosuppressive drugs. Answer. A. Start a second-line drug regimen. Rationale. For drug-resistant tuberculosis, second-line drugs are required to effectively treat the infection. First-line drugs are ineffective against resistant strains. Continuation of the current regimen or switching to immunosuppressive drugs would be inappropriate. Question 14. What is the most common side effect associated with pyrazinamide in tuberculosis treatment? A. Hyperuricemia. B. Hepatotoxicity. C. Ototoxicity. D. Peripheral neuropathy. Answer. A. Hyperuricemia. Rationale: pyrazinamide is known to cause hyperuricemia, which can lead to gout. Hepatotoxicity is associated with isoniazid and rifampin, ototoxicity with streptomycin, and peripheral neuropathy with isoniazid. Question 15. Which of the following statements regarding tuberculosis treatment in pregnant women is correct? A. Rifampin should be avoided during pregnancy. B. Isoniazid is considered safe during pregnancy. C. Pyrazinamide is contraindicated during pregnancy. D. Streptomycin should be used as the first-line drug. Answer: B. Isoniazid is considered safe during pregnancy. Rationale: isoniazid is considered safe for use in pregnant women with tuberculosis, and its benefits outweigh potential risks. Rifampin is generally safe but should be used with caution. Pyrazinamide and streptomycin are not recommended during pregnancy due to potential fetal harm. Question 16. What is the main reason for the high rate of relapse in patients with tuberculosis who do not complete the full treatment course? A. Development of drug-resistant strains. B. Malabsorption of medications. C. Inadequate drug concentration in the lungs. D. Lack of adherence to medication regimen. Answer: D. Lack of adherence to medication regimen. Rationale: the primary cause of relapse is non-adherence to the prescribed treatment regimen, which can lead to incomplete eradication of the bacteria. While drug resistance and inadequate drug concentration are important, adherence is the most critical factor in successful treatment. Question 17. A patient with tuberculosis is experiencing side effects from isoniazid. Which of the following interventions would be most appropriate to manage these side effects? A. Administer vitamin B6 supplementation. B. Discontinue the isoniazid therapy. C. Increase fluid intake. D. Start corticosteroid therapy. Answer: A. Administer vitamin B6 supplementation. Rationale: isoniazid can cause peripheral neuropathy, which can be alleviated with vitamin B6 supplementation. Discontinuing isoniazid or starting corticosteroids is not recommended, and increasing fluid intake is unlikely to address the side effects directly. Question 18. Which of the following is the primary reason for the use of combination therapy in tuberculosis treatment? A. To minimize side effects. B. To prevent the development of drug resistance. C. To reduce treatment duration. D. To improve patient compliance. Answer: B. To prevent the development of drug resistance. Rationale: combination therapy is used in tuberculosis treatment to prevent the development of drug resistance. It ensures that the bacteria are attacked by multiple drugs with different mechanisms of action, reducing the chance of resistance. Question 19. In patients with HIV and tuberculosis, what is the most important factor in determining the outcome of treatment? A. The degree of HIV immunosuppression. B. The presence of pulmonary TB. C. The type of antiretroviral therapy used. D. The patient's nutritional status. Answer: A. The degree of HIV immunosuppression. Rationale: the degree of HIV immunosuppression, as indicated by CD4 count, is the most important factor influencing the outcome of TB treatment. The more immunosuppressed the patient is, the more challenging it is to treat both HIV and TB effectively. Question 20. What is the most effective preventive measure for tuberculosis in healthcare settings? A. Routine use of antibiotics for all staff. B. Wearing surgical masks by all patients. C. Implementation of airborne infection isolation rooms. D. Routine BCG vaccination for all staff. Answer: C. Implementation of airborne infection isolation rooms. Rationale: the most effective preventive measure is the use of airborne infection isolation rooms to prevent the spread of TB to healthcare workers and other patients. Antibiotics and masks are not as effective in preventing transmission. Routine BCG vaccination is not recommended for healthcare staff in most countries. Question 21. In patients with HIV, which of the following is the most important consideration when initiating tuberculosis treatment? A. Starting antiretroviral therapy, ART, simultaneously with TB treatment. B. Deferring ART until TB treatment is complete. C. Administering rifampin-based therapy for both TB and HIV. D. Monitoring for drug-drug interactions between ART and TB medications. Answer: D. Monitoring for drug-drug interactions between ART and TB medications. Rationale: the key consideration is to monitor for drug-drug interactions between ART and TB medications, especially rifampin, which can reduce the effectiveness of certain ART drugs. Starting ART immediately or deferring it depends on the patient's condition, but interactions must be closely managed. Question 22. What is the primary reason for the development of extensively drug-resistant tuberculosis, XDR-TB? A. Incomplete treatment regimens. B. Noncompliance with infection control measures. C. Lack of early diagnosis. D. Use of second-line drugs in drug-sensitive TB. Answer: A. Incomplete treatment regimens. Rationale: the primary cause of XDR-TB is the incomplete or improper use of treatment regimens, leading to the development of resistance to both first-line and second-line drugs. Noncompliance, delayed diagnosis, and incorrect drug use contribute, but incomplete treatment is the most critical factor. Question 23. Which of the following conditions is most likely to cause false negative results in a TB skin test, TST? A. HIV infection. B. Immunosuppressive therapy. C. Pregnancy. D. Severe malnutrition. Answer: B. Immunosuppressive therapy. Rationale: immunosuppressive therapy, including corticosteroids, can suppress the immune response to the TB skin test, leading to false negative results. HIV infection and severe malnutrition can also affect the immune response, but immunosuppressive therapy is the most significant factor. Question 24. Which of the following factors is most likely to result in the failure of tuberculosis treatment? A. The use of only one antitubercular drug. B. Initiating treatment without a positive smear. C. Starting treatment before confirmation of diagnosis. D. Adding corticosteroids to the treatment regimen. Answer: A. The use of only one antitubercular drug. Rationale: the use of a single antitubercular drug leads to treatment failure and resistance. TB treatment requires a combination of drugs to ensure effectiveness and prevent the development of drug-resistant strains. Initiating treatment without confirmation or adding corticosteroids may have other risks, but is not as directly linked to failure as monotherapy. Question 25. Which of the following is the most common cause of treatment failure in patients with multidrug-resistant tuberculosis, MDR-TB? A. Poor nutritional support. B. Inadequate drug regimens. C. Non-adherence to treatment. D. Comorbid conditions. Answer: C. Non-adherence to treatment. Rationale: non-adherence to treatment is the most common cause of treatment failure in MDR-TB. Proper adherence to the prescribed drug regimen, which often lasts up to 2 years, is critical in managing MDR-TB. Inadequate drug regimens and comorbid conditions also contribute, but are secondary to adherence issues. Question 26. Which of the following is an appropriate method for preventing the transmission of tuberculosis in healthcare settings? A. Routine BCG vaccination for healthcare workers. B. Mandatory isolation of all patients with suspected TB. C. Routine sputum testing of all healthcare workers. D. Implementation of an airborne infection control program. Answer: D. Implementation of an airborne infection control program. Rationale: an airborne infection control program is the most effective way to prevent the transmission of tuberculosis in healthcare settings. This includes the use of isolation rooms, N95 masks, and proper ventilation. Routine BCG vaccination and sputum testing are not recommended for all healthcare workers. Question 27. What is the most appropriate next step in managing a patient with suspected drug-resistant tuberculosis? A. Start empirical second-line therapy. B. Wait for results from a sputum smear. C. Conduct drug susceptibility testing. D. Treat with a first-line regimen and monitor for response. Answer: C. Conduct drug susceptibility testing. Rationale: drug susceptibility testing (DST) is crucial in identifying the specific resistance profile of the TB strain, which will guide appropriate treatment. Empirical second-line therapy may be used in emergency cases, but DST is the definitive method to ensure correct treatment. Question 28. A patient on isoniazid therapy for tuberculosis develops peripheral neuropathy. What is the most appropriate intervention? A. Discontinue the isoniazid therapy. B. Add pyridoxine, vitamin B6, supplementation. C. Switch to a second-line drug regimen. D. Increase the isoniazid dose. Answer. B. Add pyridoxine, vitamin B6, supplementation. Rationale. Peripheral neuropathy is a known side effect of isoniazid, and the most appropriate intervention is to add pyridoxine, vitamin B6, to prevent or treat this condition. Discontinuing isoniazid may not be necessary unless the neuropathy is severe. Question 29. In patients with tuberculosis and diabetes mellitus, which of the following is most important to monitor during treatment? A. Blood glucose levels. B. Electrolyte balance. C. Renal function. D. Serum calcium levels. Answer. A. Blood glucose levels. Rationale. Diabetes mellitus can affect the immune response and complicate tuberculosis treatment. Blood glucose levels must be closely monitored to prevent hyperglycemia, which can further suppress the immune system and hinder TB treatment. Question 30. Which of the following is a characteristic feature of miliary tuberculosis? A. Presence of large cavitary lesions. B. Generalized systemic spread with small granulomas. C. Persistent dry cough with no sputum production. D. Clear lung fields on chest X-ray. Answer. B. Generalized systemic spread with small granulomas. Rationale. Miliary tuberculosis is characterized by widespread dissemination of Mycobacterium tuberculosis throughout the body, with small granulomas visible on imaging. Cavitary lesions and dry coughs are more typical of localized pulmonary TB, not miliary TB. Question 31. In the management of tuberculosis, which of the following laboratory tests is most useful for confirming the presence of drug-resistant strains? A. Sputum smear for acid-fast bacilli. B. Chest X-ray. C. Drug susceptibility testing. D. Interferon gamma release assays, IGRAs. Answer. C. Drug susceptibility testing. Rationale. Drug susceptibility testing, DST, is the definitive test for confirming drug resistance in tuberculosis. Sputum smears, chest X-rays, and IGRAs can help in diagnosis and assessing the immune response, but are not useful for identifying drug-resistant strains. Question 32. Which of the following factors is most closely associated with the development of drug-resistant tuberculosis? A. Inadequate drug dosages. B. Long duration of treatment. C. Low viral load in HIV patients. D. High baseline body mass index, BMI. Answer. A. Inadequate drug dosages. Rationale. Inadequate drug dosages, improper treatment regimens, or non-adherence to the full course of treatment are the primary factors leading to the development of drug-resistant tuberculosis. Long treatment durations and other factors, like HIV viral load or BMI, are less directly related. Question 33. Which of the following is a key consideration when treating tuberculosis in pregnant women? A. Isoniazid and rifampin should be avoided. B. Pyrazinamide is the drug of choice. C. Treatment should focus solely on symptom management. D. Standard first-line drugs are considered safe. Answer. D. Standard first-line drugs are considered safe. Rationale. Standard first-line drugs, isoniazid, rifampin, ethambutol, and pyrazinamide, are generally considered safe during pregnancy. Treatment is crucial to prevent maternal and fetal complications. Avoiding these drugs would be inappropriate. Question 34. A patient with tuberculosis requires second-line drugs due to drug resistance. Which of the following is a common side effect of second-line drugs? A. Ototoxicity. B. Hypothyroidism. C. Nephrotoxicity. D. Hypokalemia. Answer. C. Nephrotoxicity. Rationale. Nephrotoxicity is a common side effect of second-line drugs, such as aminoglycosides, e.g. amikacin kanamycin, used in treating multidrug-resistant tuberculosis. Ototoxicity can also occur, but nephrotoxicity is more common. Question 35. A patient with tuberculosis is placed on treatment with a regimen that includes rifampin. Which of the following interventions should the nurse prioritize? A. Ensure the patient is on a low-fat diet. B. Monitor for signs of liver dysfunction. C. Administer the medication at bedtime. D. Advise the patient to avoid exercise. Answer: B. Monitor for signs of liver dysfunction. Rationale: rifampin can cause hepatotoxicity, so liver function should be monitored regularly. It is not necessary to restrict exercise, give the medication at bedtime, or put the patient on a low-fat diet unless otherwise indicated. Question 36. What is the role of the BCG vaccine in tuberculosis control? A. It is used to treat active tuberculosis. B. It is used to prevent the transmission of drug-resistant strains. C. It provides protection against all forms of tuberculosis in adults. D. It primarily prevents severe forms of tuberculosis in children. Answer: D. It primarily prevents severe forms of tuberculosis in children. Rationale: the BCG vaccine is primarily used to prevent severe forms of tuberculosis, such as TB meningitis and miliary TB, in children. It does not provide complete protection against all forms of TB in adults, and is not effective against drug-resistant strains. Question 37. In a patient receiving tuberculosis treatment, which of the following laboratory findings would indicate a potential complication of therapy? A. Elevated liver enzymes. B. Low white blood cell count. C. Elevated creatinine. D. High blood pressure. Answer: A. Elevated liver enzymes. Rationale: elevated liver enzymes indicate potential hepatotoxicity, a common complication of TB treatment, particularly with isoniazid and rifampin. While other conditions may also arise during TB therapy, liver dysfunction is the most concerning. Question 38. Which of the following symptoms in a patient with tuberculosis would require urgent evaluation for potential complications? A. New or worsening hemoptysis. B. Low-grade fever for more than 2 weeks. C. Persistent non-productive cough. D. Fatigue and loss of appetite. Answer: A. New or worsening hemoptysis. Rationale: hemoptysis, coughing up blood, is a serious symptom and may indicate worsening TB, a complication such as lung cavitation or drug-resistant TB. Other symptoms, while concerning, do not typically require urgent evaluation unless they are severe or worsening. Question 39. A patient with tuberculosis is diagnosed with hepatitis as a side effect of treatment. What should the nurse do first? A. Discontinue all tuberculosis medications immediately. B. Provide supportive care and monitor liver function. C. Switch to second-line tuberculosis drugs. D. Administer vitamin K to manage clotting. Answer: B. Provide supportive care and monitor liver function. Rationale: if a patient develops hepatitis, the nurse should provide supportive care and closely monitor liver function. Discontinuing medications should only occur after consulting with a physician, and second-line drugs are typically reserved for more severe cases. Question 40. What is the most common complication of tuberculosis that requires long-term follow-up? A. Pneumothorax. B. Pulmonary fibrosis. C. Chronic kidney disease. D. Bone marrow suppression. Answer: B. Pulmonary fibrosis. Rationale: pulmonary fibrosis is a common long-term complication of tuberculosis, especially in patients with chronic or untreated TB. Pneumothorax, kidney disease, and bone marrow suppression are less common and more likely to occur in severe or advanced cases.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.